Hello student, welcome to my channel. So let's get started with the pharmacology topic, that is a general anesthetic. This is the second video on the topic. In the first video, I told about the basic difference between the general anesthetic and the local anesthetic. Then what are the important cardinal features of the general anesthetic, like you have unconsciousness, then we have analgesic action, muscle relaxation, all the reflexes will be lost and recovery is there. And all these things, they are not achieved by a single drug. We have to give different drug like pre-anesthetic medication, inducing agent, maintenance and neuromuscular blocker agent. Then once you give the anesthesia, there are the four stages, and especially this is seen with the ether. And Goodall, he proposed these four stages in 1920. So stage of analgesia, excitement, then surgical anesthesia and medullary paralysis. This is the stage 3, where we are going to start the surgery. Now continuing in my second video, how the general anesthetic they work, or in other words, what I am going to tell, what is the mechanism of action of general anesthetic. So general anesthetic, multiple site and multiple mechanism. पहले नहीं पता होता था ये कैसे काम करती, but there are the multiple sites and multiple mechanism are involved in its action. So the various component of the general anesthetic, they are going to involve action at a discrete site in the cerebrospinal axis. Like what are the various component of the general anesthesia? We have unconsciousness, then we have amnesia, then we have analgesic action and immobility. ये सारों के लिए क्या है? This general anesthetic, it is going to produce this action, but they act at a multiple site. Like the most important site, that is RAS, this reticular activating system. Okay, you can see here this purple color reticular activating system and this thalamus. So the action of the general anesthetic at these two sites, 1 and 2, it is going to produce the unconsciousness. Unconsciousness, because this is the site, these site they maintain, ये जो आपका दोनों है RAS and thalamus, they are involved in maintaining wakefulness. So once the GA or general anesthetic, it is going to act on these two sides, then what will happen? It is going to produce the unconsciousness, or there will be loss of consciousness. Now coming to the second one, amnesia. Amnesia result by action of this general anesthetic at these three sites. Past में amygdala, then this is a hippocampus and a prefrontal cortex. So all these action of general anesthetic on these sites leads to amnesia. Now coming to the analgesic action or immobility. So immobility or analgesic action, that is going to involve this spinal cord. See how the pain transmission that is carried, कैसे ट्रांसमिशन कैसे होती है पेन की. सपोज ये है, आपने नीडल यहाँ पे कहीं पे भी स्किन पे, इफ somebody pricks you here, कहीं पे भी आपके यहाँ पे अगर prick हुआ है, then what will happen? The pain, it will be carried by the nerves. ये nerve से जाके where it will relay will be there in the spinal cord. फिर from the spinal cord where it will go to the thalamus, and then from there to the cortex. This is how the pain is transmitted. So general anesthetic, they act over here in the spinal cord and they leads to analgesic. अगर बेटा analgesic एक बार action हो गया, suppose if somebody is pricking me here and I am not getting any pain, then definitely I will not withdraw my hand. So immobility, that will be there. So immobility and analgesic action is due to its action where? Its action on the spinal cord. So what I have explained earlier, so the various component of general anesthetic involve the action at various sites. So these are the component of the general anesthetic. So you can see here the various component of the anesthetic. I'll highlight it. Okay, the component of anesthetic, this is कौन से component है? Unconsciousness, amnesia, immobility and analgesia. And they involve what all sites? They are going to involve this. The first one is unconsciousness by RAS and thalamus. Amnesia, it involves the hippocampus and amygdala, prefrontal cortex, and immobility, analgesic action, they are by the action in the spinal cord. So this is at the macroscopic level. अब ये है कि अब यहाँ पे exactly हुआ क्या है, what exactly happens at this site. ठीक है. So molecular mechanism कौन सी चीज है which is going to involve, और जिससे ये पता लगे कि exactly हुआ क्या है यहाँ पे. ठीक है. So molecular mechanism क्या है? So molecular mechanism of action of general anesthetic. So multiple molecular mechanism they are there. ठीक है. So multiple molecular different general anesthetic they act by different molecular mechanism. ठीक है. जितने भी आपके anesthetic है, क्लासिफिकेशन नहीं मैंने अभी बताई, बट हाँ, तो different we give it by inhalational route, we give it by IV route. Inhalational में भी आपका gases है, volatile liquids are there. Then IV से भी आपके different fast acting, slow acting general. So different general anesthetic they are going to act by different mechanism. इसीलिए बोलते हैं multiple mechanism. So molecular mechanism भी इसके there are many, but the most important the general anesthesia they are going to involve what? They are going to involve the ligand gated ion channel. Ligand gated ion channel, that is the main. और कौन कौन से ligand gated ion channel which are involved in its mechanism? So we have GABA A. This is going to get the chloride channel. Then we have a glycine gated chloride channel. Then the third one is NMDA. Then we have a nicotinic receptor. So acetylcholine wala uska nicotinic, not the muscarinic receptor. Various miscellaneous. Then 2-pore domain potassium channel. Then presynaptic alpha 2 receptor. ठीक है. बट इनमें से जो सबसे the most important is a GABA A. The most important receptor is a GABA A. ये वाला GABA A receptor. So GABA A receptor, what kind of structure it has? It is a pentameric in structure. इसकी ये structure है pentameric in structure, like a rosette it is arranged. ठीक है. ऐसे ये rosette की तरह इसकी arrangement होती है. ठीक है. So once the GABA binds to any of the sites, suppose यहाँ पे अगर GABA लग गया, then what will happen? Conformational change happens in the neuron. So like a rosette around a channel, this is inside a pore, that ion channel that is in the center. जैसे ये center वाला है ऐसे, this center में आपका ऐसे pore है, and around that क्या है आपके सारे rosette they are arranged. Once the GABA it binds with that receptor, what will happen? The conformational change will happen. This ion channel there will be inward movement of the chloride ion through this. एक बार आपका chloride ion अगर अंदर चला गया, then what will happen? Chloride ion अगर movement होगी, then that leads to the hyperpolarization of the neuron. So hyperpolarization of the neuron होगी, then this is going to decrease the neurotransmission, and ultimately there will be no neurotransmission. That is what we want. Okay? So GABA A, that is the most important this one ion channel which participates in the action of the general anesthetic. Now unconsciousness and how it is produced by this. So unconsciousness that is mediated by potentiation of GABAergic transmission, where at this two site, RAS and thalamus. And what are the general anesthetic which is going to, मैंने कहा ना different they are going to buy a different. कौन से हैं general anesthetic which is going to cause this? We have a propofol, then we have a etomidate and barbiturates. So these are the three which is going to act by this way. ये तीनों propofol, etomidate and a barbiturate. So potentiation of GABAergic transmission at RAS and the thalamus, they are going to lead to the unconsciousness. अब ये वाले जैसे drug है propofol, etomidate and barbiturate, मतलब ये they mainly going, once you give, they are going to produce the unconsciousness, that is the main. But ऐसे नहीं है कि ये नहीं करेंगे, amnesia नहीं करेंगे या immobility analgesic action नहीं आएगा, इसके साथ ये भी आएगा, but this will be the most prominent action with this. ठीक है, इसीलिए इनको भी यूज इट फॉर द इंडक्शन. नाउ एमनेजिया विल हैपन अगेन बाय द एनहांसमेंट ऑफ द GABAergic ट्रांसमिशन एट दिस साइट. तो एनहांसमेंट ऑफ GABAergic ट्रांसमिशन एट these three sites that leads to amnesia. अब इसमें कौन कौन सी आ जाती है आपकी ड्रग? वी हैव अ प्रोपोफोल एंड देन वी हैव अ मिडाजोलम. ठीक है, ये वाले ड्रग दे आर गोइंग टू कॉज द एमनेजिया. नाउ कमिंग टू द थर्ड वन, इमोबिलिटी. इमोबिलिटी भी आपका सेम है. इमोबिलिटी इज अगेन ड्यू टू द एनहांसमेंट ऑफ द GABAergic ट्रांसमिशन. सही है, इमोबिलिटी. ठीक है, सेम. नाउ एनाल्जेसिक एक्शन, ये वाला, इसमें क्या है? This is the one where GABAergic transmission does not play any role. इसमें आएगा आपका all rest, this यहाँ तक, pre-synaptic छोड़ दो, this. So augmentation of the glycine gated chloride channel. So augmentation of the in the spinal cord. Number one this. So analgesic action कैसे होगा? Augmentation of ग्लाइसिन गेटेड क्लोराइड चैनल. तो इसमें भी क्या होगा? देयर विल बी इनवर्ड मूवमेंट ऑफ द क्लोराइड. सो क्लोराइड अगर अंदर गया तो इट लीड्स टू हाइपरपोलराइजेशन, और फिर से ये सारा हाइपरपोलराइजेशन, एंड देयर इज डिक्रीज न्यूरोट्रांसमिशन एंड नो न्यूरोट्रांसमिशन. दिस इज द नंबर वन. देन another one is, so this is a, I'll change the color, this is the number one. Then number two for the analgesic action, augmentation of this हो गया ग्लाइसिन. देन इनहिबिशन ऑफ NMDA. ठीक है, देयर इज इनहिबिशन ऑफ एक्साइटेटरी टाइप ऑफ NMDA action of glutamate. So normally what happened, the glutamate it binds with the NMDA receptor. NMDA receptor भी बेटा इसी तरह का होता है. I'll just ये रब कर देती हूँ, ये भी रब कर देती हूँ. The only difference is with the NMDA receptor. There, this is suppose NMDA receptor. The inward once NMDA glutamate it binds with this receptor. अगर यहाँ पे आपका समझ लीजिए glutamate bind कर जाता है. Color will change. I will change the color. It will be easy. ठीक है. So glutamate अगर इसके साथ bind करता है, then what will happen? There will be again a conformation change will be there, and there will be inward movement of the calcium. That leads to the depolarization. लेकिन अगर हम इसको inhibit कर देते हैं, then what will happen? With the inhibition of this, so general anesthetic, they are going to inhibit the action of the glutamate on this NMDA receptor. Then there is no inward movement of the calcium. So again inhibitory action, ये हो गया number two. Number three, it is also going to inhibit the nicotinic receptor or action of acetylcholine. It is going to inhibit the action of acetylcholine or nicotinic, ऐसे याद करो, nicotinic receptor. ठीक है. So with this what will happen? There is a no movement of the sodium ion. फिर से depolarized sodium, it also sodium and calcium, they are the very important ion which plays important part in the depolarization. तो वो नहीं होगा. Then same way the two pore dominant potassium channel, it is also going to open this potassium channel. जब potassium channel open होता है, remember one thing, the potassium it will move outside. Okay, so once the potassium will move outside, then what will happen again? Positive ion आपका बाहर गया तो hyperpolarization will be there. So there will be decreased activity of the neuron. So इसमें क्या कौन सी आपकी drug आती? What are the anesthetic which comes under this? So important anesthetic जो आपके आते हैं like N2O, then we have a ketamine, then we have a fluorinated. मोस्ट ऑफ द फ्लोरिनेटेड जनरल एनास्थेटिक जिसमें आपका हाइलोथेन आ जाता है, आइसोफ्लोरिन आ जाता है, सिवोफ्लोरिन आ जाता है, ऑल ऑफ देम दे आर गोइंग टू प्रोड्यूस एनाल्जेसिक एक्शन बाय एक्टिंग एट दीज फोर. तो ये फोर वाला भी कर लो. तो पोटाशियम चैनल. नो लेफ्ट इज वन. ये वाला मैकेनिज्म प्री साइनेप्टिक अल्फा 2 रिसेप्टर. अब इस पे कौन सी ड्रग काम करती है? देयर इज वन जनरल एनेस्थेटिक एक्शन एनेस्थेटिक ड्रग दैट इज डेक्स मेडिटो डेक्स मेडिटोमेडिन. ठीक है, ये वाली. नाउ हाउ दिस ड्रग इट इज गोइंग टू एक्ट. So remember one thing, I'll draw here. This is one neuron, or you can say this is a adrenergic neuron. And this is a presynaptic है आपका. And this is a postsynaptic. What will happen here? Na they are stored. This is a adrenergic neuron. So what will happen once the action potential with the generation of the action potential, what will happen? This norepinephrine release will be there on the synapse, and here what happens? There are the receptors. आपके alpha beta receptors, they are there. Alpha 1 beta receptor, they are going to act on the receptor. ये इस receptor पे काम करेंगे and they are going to produce the action. Now on the presynaptically there are alpha 2 receptor which are present in this neuron. Now this norepinephrine it is going to act here also. पहले तो ये इस पे काम करता है. Norepinephrine first it is going to पहले ये इस पे काम करेगा. This is the first, and then it is going to act here also. अब जब ये यहाँ पे presynaptically if it is going to act, जब ये presynaptically काम करता है, then what it is going to do? It is going to inhibit the further release of this norepinephrine. अब ये norepinephrine नहीं आएगा, then what will happen? There is a decrease in neurotransmission and ultimately there will be no neurotransmission. अब ये drug क्या करती है? This is going to act here on the alpha 2 receptor. सेम एक्शन जो नॉरएपिनेफ्रिन रिलीज करने के बाद अल्फा 2 पे काम करती है ना, तो दिस डेक्समेडिटोमेडिन इट इज गोइंग टू एक्ट ऑन द प्रीसाइनेप्टिक अल्फा 2 रिसेप्टर. इट इज गोइंग टू इनहिबिट द रिलीज ऑफ norepinephrine. यहाँ से ये नहीं होगा, and when there is no norepinephrine it is not going to bind postsynaptically with the receptor and there will be no neurotransmission. So this is how the various anesthetic, general anesthetic, they act. So hope it is clear to all of you. So if you like my video, please subscribe my channel and put the important comment in the comment box.